037. Before I take my first caller, Kingdom Books and Stationery is now offering a 30-day credits facility with no interest charge. We deliver free within Accra, Tema, and surrounding towns. Visit us today at Osu Akwaje, University of Ghana campus. Kingdom Books are next near the Accra Sports Stadium, Tema, on the main TDC junction, Kumasi on the KNUST campus, Cape Coast on the UCC campus, Takrade at Fijai near the Teachers Hall, or you can call 0302 764 101 or 762 307 or visit kingdomgh.com. Kingdom Books and Stationery Limited, your number one stop shop for all office essentials, stationery and furniture. Now, flying within West Africa just got better on Africa World Airlines. Starting this 1st of October 2018, enjoy direct flights from Freetown, Sierra Leone to Monrovia, Liberia, 4 times weekly on Mondays, Wednesdays, Fridays, and Sundays. Fly in style and comfort for as low as $199. You can also fly seamlessly from Accra to Lagos and Abuja, Nigeria, Lagos to Monrovia, Liberia, and Freetown, Sierra Leone, and Accra to Monrovia and Freetown with world-class service. Book now on our website www.flyafricaworld.com and pay with your Visa or MasterCard, MTN mobile money, or call toll-free 0800 200 200 at any AWA sales office. You can also purchase AWA tickets at our partner banks branches, Zenith, GT, UBA, UMB, and Access Bank, as well as travel agents nationwide. Connecting West Africa, Africa World Airlines, touching Africa, touching the world. I have my first caller on the line. Her name is Ekia from Osu. Before, let me take Ekia's question. Good morning, Ekia.
Good morning, Kojo. How are you?
I am fine. This is Daniel, but it's fine. So what's your question for Prof?
Kojo, I want to ask Prof. I've had 3 operations on my breast before. I've done mammograph. There was a time I was feeling like a little chokes inside. You'll be there and something will choke you. I went to Kolebu. They asked me to do mammograph. They said there's nothing inside. But once in a while, I still feel it. Anyway, then a friend of mine also had this big lump in the breast. She went there. They said there is nothing. She should go and do the mammograph. She did it, and they said it's still nothing. And so the lump is in the breast, very big. I don't know what to do because I know Kolebu is the only last place we can always count on.
Okay. Thank you very much, Ekia, for calling us. You can also call on 0302 216 541. Prof, let's take the answer to that one. So she felt a choking in her breast. She went for a mammogram. Right. They told her there's nothing wrong with it. And her friend has a big lump in the breast.
Right. Let's take the 2 scenarios. Breast cancer is usually not painful when it starts. Many women get worried when they have pain. We'll still check it. And when we check and there's nothing in that breast, then believe us when we say there's nothing wrong with you. However, if there's a lump, like the second scenario you give us, we will not leave such a lump in the breast. Even if our tests show that it is nothing, normally we will still get rid of that lump. So I think we'll like to see this lady.
Okay, so she should come to
the
breast center.
She should come to see us at the breast clinic on Wednesday.
Okay. But I have a question. If it's a lump and it's not breast cancer, can it still lead to the removal of the breast?
No. If it's not breast cancer, we will still remove that lump if you are in the correct age group.
No matter how big it is? Yes,
we'll remove it. And if it's cancerous, you may have to lose the breast.
Okay.
But not all breast lumps are cancerous.
Yeah. Okay, so not all breast lumps are cancerous.
Yes.
That point needs to be made. 0302 216 541. I saw a tweet earlier to you, Doc. Yes, at Belinda_Damwa says, is it true that when a guy sucks your breast, it can also cause breast cancer?
No, it doesn't. There are quite a number of misconceptions about breast cancer and what causes it. No, sucking of the breast does not.
What about the opposite? I've heard that sucking of breast helps prevent breast cancer.
It helps prevent if you are breastfeeding and your baby sucks your breast. But if you are not breastfeeding, no amount of sucking would protect you.
Okay. It's only when you're
It's only
breastfeeding.
when you're breastfeeding.
All right. Kelvin is calling from Sacramento. Good morning, Kelvin.
Good morning.
Great. What's your question?
It's more than a question.
Kelvin, please reposition yourself. We can hardly hear you.
Okay, is that better?
We can still get better. Try moving away from where you are.
All right, is that better?
It's much better now. Let's hear you.
All right. I was saying that it's more of a contribution than a question, although there's an inherent question. My contribution is, a patient once recounted to me how, like, between time for diagnosis and then when she eventually had her mastectomy, everything happened so quickly. It was like a whirlwind for her. And was, I understand that there's pressure on the doctors and all of that and the team because of the patient's load and all that. But it appears as though, like, the support system wasn't exactly there. So she had this diagnostical blow between when she was diagnosed.
Yes, so Kelvin, I'm losing you again. Kelvin, please try calling back. Sorry about that. 02443 0302 216541. So, Doc, what are some of the Prof, what are some of the other misconceptions that you often come against when dealing with breast cancer?
Right. There's also, the first one probably is that if it's not painful, then it's not breast cancer. I think that's a big one because most of them are not painful. And so you find women with all sorts of changes in their breast who will not come to hospital because it's not painful.
Okay.
Then others believe that it's a spiritual disease. And because of that, they try to tackle it spiritually. So they will go to see a priest or a prophet and so on. And even when it's not working, they will still not come to hospital. So that's another problem about the cause of the disease.
And on that point, I understand Dr. Joel Yanni has been part of a group that has done some research into persons' preferences when it comes to treating such conditions. And interestingly, young, educated women are more likely to go for alternative forms of medication, including spiritual forms and what have you. Prof, sorry, before you go into the next misconception, let's take SNM's question. She's calling from Kumasi. Good morning, SNM.
Hello, good morning.
Great. What's your question for Prof?
Okay, my question is that when I was about 17, I had a lump in my breast, which was taken out, and they said it was fibroadenoma. But since then, I've been having this burning sensation. I went for a mammogram recently, and they said there's nothing in it, but I keep feeling it.
Okay, thank you very much, SNM, for calling us from Kumasi. Let me add this question sent through WhatsApp. I heard the doc say the side effect goes away. I was diagnosed at age 38 and was told the chemo will destroy my ovaries, so I can't have any children. That's the side effect. Can he clarify this, please? I was also told at a hospital that the lump is nothing, but it turned out to be stage 2. Okay. Let me take Kelvin back. Kelvin, you had a question and you had a contribution, but we couldn't hear you so well. Good morning again, Kelvin.
Yes, please. I hope the line is better now.
It's much better now. Let's hear you.
All right. So to summarize, I wanted to ask if there's opportunity for adequate psychological support for patients who are diagnosed with breast cancer. Like I was saying, this patient who recounted her story, it's like between diagnosis and then eventual treatment, everything happened in such a whirlwind that she felt really overwhelmed. And sometimes that psychological effect, it's like it's even, quote unquote, worse than the actual treatment to save her life.
Thank you very much.
Additionally, I wanted to add that most people who are diagnosed tend to run away from orthodox treatment and then resort to herbal medications and all of that. I hope that I could be hammered on that outside orthodox treatment, most other alternatives really do not work. So I hope that message could be sent across.
Okay. Thank you very much, Kelvin, for calling in. So a caller has called in and left a question, and she wants to know if there's any research backing breastfeeding preventing breast cancer. Okay, so that was a point that was made earlier by Prof. Prof would address that for you. So we have quite a number of questions. The first one was from Ikea.
Yes, I don't know which one was Ikuya's question. I have quite a few questions here.
Okay.
But let me just go through them. About the treatment for breast cancer, the side effects of the treatment waning after a while. Yes, most of them do. You stated that the ovaries may be affected by chemotherapy, and that's true. Again, most of that will recover. However, if you are getting close to the menopause, then there's a chance that it may not recover properly. So yes, there's a group of women in which after chemotherapy, their ovaries will not recover fully, in which case having children may be a challenge.
That's unfortunate.
Yes, and we are increasingly being more aware of this now, and so we try to give counseling concerning this, especially if the woman has not had a child at all. Then there are ways in which you could try to protect the ovary during chemotherapy, or even try to save eggs and so on. And we do this in conjunction with some gynecologists.
Since you're on the point on counseling, let's deal with Kelvin's point he was talking about.
Yes.
Yeah.
Counseling is very important. Again, over the past, I'll say 5 to 10 years, we are taking many more measures about this. So I think we heard from Kumasi that they use counselors. We also have a clinical psychologist on our team now, and we have breast nurses who do a lot of counseling in addition to the survivors.
Okay.
So we are taking care of that.
About how long would a patient go through counseling before the final procedure?
Well, that will depend on how much counseling they need.
Okay.
There are patients who will need counseling for quite a while before they come around to accept that this is what they really want to do. And the others who practically need no counseling. I mean, they've thought about it, they've worked it out, and they come and say, look, I'm ready. And even when you say, oh, I want to save this breast, they say, no, take the whole breast off. These are people who have come to terms with it, and they know exactly what they want. So it depends on the person, really.
Okay, let me take a couple more questions before we deal with so you add them to the ones that you haven't dealt with yet. Kofi Bajuma is on the line from Kumasi. Good morning, Kofi.
Good morning, Daniel. How are you?
I am blessed. How are you?
Yeah, I'm fine. I want to ask the doctor. Did I hear him saying that sucking of breast by men is not one of the causes of the breast cancer?
Yes.
And two, how many types of cancers do we have? Breast cancer and what? And what is the difference between the breast cancer and other cancers, if there's any?
Thank you very much, Kofi. Yes, thank you very much, Kofi, for calling. Omusumuru is also on the line from Domabing. Good morning, Omusumuru.
Yeah, good morning.
Yes, let's hear you. I'm blessed. Let's hear you.
Okay, thank you for the good work you are doing. I wanted to ask if a woman is breastfeeding a baby and she's pregnant, does it have any effect on the baby? And if it has an effect, what would be the effect?
Breastfeeding whilst pregnant?
Yes.
Okay, thank you. Omusumuru called there from Domabing. So we will not take any more callers. Prof would address your questions now, and we'll move on. So, Prof.
Yes. So there was a question on the types of breast cancer and how it's different from other cancers. Basically, cancer can affect any part of the body. So you can have cancer of the brain, cancer of the eyes, cancer of the nose, the throat, the intestines,
the lungs,
everywhere. So the breast is only one. In fact, cancer of the blood also occurs. So cancer can affect practically any part of the body. So breast cancer is only one. But to make it a bit more complicated, even breast cancer is not one disease. There are different types of breast cancer, and that's why we need to test these cancers and know exact type of cancer. Then we know exactly how to treat it. So there are different types of cancers.
Okay.
About the breastfeeding, I didn't quite get the question. If a woman
whilst pregnant,
and you are breastfeeding, whether it affects the baby. No, it shouldn't affect.
Any of them, the baby or the mother?
Or the mother. No, it doesn't.
Okay, there are no side effects whatsoever
No, there are no side effects of that.
Okay.
But what I would like to say at this point is, if you have breast cancer and you breastfeed, Does it affect the baby? Again, no. Breast cancer is not transmitted. So it's not transmitted to a baby. It won't be transmitted to the husband during sexual intercourse or anything like that. So breast cancer cannot be transferred. I thought I should make that point as well.
This person sent a message. My mother is 95 years and she has breast cancer. What can we do?
We can do a lot for her. She can still have surgery. She can still have the other forms of treatment, except that because of her age, and if she suffers from other diseases, then often we'll choose treatments that are, if you like, mild rather than quite strong ones.
Mm-hmm. Yeah. Does that deal sufficiently with all the questions we have?
Yes, there was somebody who said she was assured that there was nothing wrong with her breast, only to find that it was cancer. Unfortunately, these things do happen, but really it shouldn't. Because in the diagnosis of breast cancer, we go through 3 different stages. What the doctor feels with their hands and the history they take. Then we have x-rays that we do. And even if these are negative, so long as there's a lump, they would like to test that lump, take part or all of it to the pathologist to have a look. And once you've gone through those 3 steps, the chances of missing cancer are virtually nil. So yes, it does happen. I know it does happen, but it shouldn't happen.
Right. And finally, hello Daniel, I'm 22 now and I have been diagnosed with fibroadenoma. I've had 2 surgeries in both breasts, and just recently I've noticed another development in the right breast again. Also, I'm the first in my family to experience this. I'm so scared to undergo surgery again. Please, what causes the development again?
Fibroadenoma is benign. It's not cancerous. Unfortunately, you can have many of them in the breast, and it can happen on both sides. And
so it's a growth like a breast cancer lump.
Well, it's not like it, but it's also a growth.
We
can tell the difference when we see. But it's also a lump. But we often would like to test it. But once we've tested it, if we've done 2-3 surgeries, and there's another one, often we can tell that this is not cancerous. And we can even use just a needle to just sample some of the cells there. And so long as we are sure it is not, you don't have to have surgery every time for your fibroadenoma. Okay.
So, Prof, finally, before you go, what are some of the activities that we are undertaking as part of the Breast Cancer Awareness Month?
Right. We are out in town trying to educate people. But I'll quickly mention 29th of October is Monday. We have a symposium for the general public. So come and have all your questions answered. This will be at Accra City Hotel, 29th at 4:30 p.m. We have the all girls lipstick band from Plus 233. They'll be there to entertain you as well.
Okay.
And there will be experts from Kolebu. There will be survivors around. And there will be advocates. So you can have all your questions answered on the 29th.
And this person asks, and I know it's part of what you're about to say, where can someone go for breast screening?
We have a list of partner hospitals. We have about 30 partner hospitals in Accra and outside Accra who are all offering free screenings. If you go to our breast clinic, breasts unit Facebook page, you would find the list there and when you can go. But in Kolebu, we are open every day of the week, weekdays. At 2 o'clock, you can just walk to the surgical block and you'll be screened free of charge. But after the month, you can always come on Tuesday by 11 o'clock to the radiotherapy center. No referral. You can just walk in and somebody will see you.
Okay, you don't need a referral to come to the radiotherapy center.
No, that is on Tuesdays.
On Tuesdays from 11
as a breast clinic.
Okay, and I understand there's free breast screening ongoing in some malls.
Yes, and then in Accra Mall and Junction Mall, every weekend of October, we are at the malls doing free breast screening as well.
Thank you so much, Professor Clegg Lamptey, for joining us.
Welcome.
Professor Clegg Lamptey is the head of the breast unit at the Kolebu Teaching Hospital, and he has been educating us on breast cancer. Remember, on Monday there's another symposium going on that you can attend. Still listening to the Super Morning Show. Enjoy 99.7 FM. So what has happened is that we have a huge backlog of messages from our earlier topic that we have not been able to deal with. A few more contributions on this one as well. Prof has been reading through some of them on our screen here. So we'll take these messages, we'll come back, and then we'll read through some more of them. Stay with us. This is the Super Morning Show.
At Afrodan, we believe that many of the problems people have with their health is as a result of the way they sit. In other words, your chair can kill you. Here's Dr. Marcus Mann of the Chiropractic and Wellness Center.
What you have to remember is that the spine is the lifeline to your body, and posture is the window to that spine. Now, posture is affected by your daily activities and habits like sitting. That's why at the chiropractic